right, so looks like we've got 11:05 on here, so let's begin our presentation. We are going to start with a few announcements briefly before I pass it off to Sarah to continue the main part of the program. So this is a reminder to everybody. Latoya Hall down at the Institute of Gerontology is part of the SAFE program, and they offer financial assistance and coaching services. And they can contact you either using Zoom or via the telephone. Again, these are free services available for older adults. If you're interested, please contact Latoya at l.hall@wayne.edu or at the office, area code 313-664-2608. All right. So this is the Healthier Black Elders Center. And one of our goals, again, is to reduce health disparities in older Black adults. And that happens via the opportunity to participate in non-invasive medical research. So if you join our participant resource pool, excuse me, we have a number of things we can offer you. First and foremost, our monthly lunch and learns like we're doing today here. We run these seminars virtually right now. Hopefully we're going to be getting back in person soon on various health related topics that can be useful for you. That didn't was supposed to happen. We have the weekly party line, social hour Zoom, and I'll have the slide up on that shortly with information to join on Tuesdays. We'll also mail you quarterly newsletters containing articles sharing vital health information. And again, we have opportunities within the PRP to join in and participate in social behavioral studies and learn about how to participate in safe and ethical research. Next Wednesday, for residents of Shiawassee, Lapeer County, Senior Power Day, the signature event for the Valley Area Agency on Aging, is going to be happening at Crossroads Village. Tickets are $4, and the ticket includes lunch and a train ride. We are going to be running tables there, so if you'd like to meet us in person, this is a wonderful event. Tickets are available now at your area senior centers in Genesee County, or you can contact BAAA directly, or you can get tickets in person at Crossroads Village. Again, this is a wonderful event, big event with a number of great organizations doing outreach. We also had the opportunity to meet some local politicians to discuss the needs of the senior population. So if you have the ability, Wednesday, May 25th from 9 to 2, come join us. All right, and this is the follow-up on the party line. It's a virtual social group that we put together during the pandemic, and this is open for anybody who may be feeling a little bored, a little isolated, and just want to be together, want to be with people. So this is hosted down at Wayne State, and there are stories, conversations, discussions on movies, games, and all sorts of, depending on the week. There's a weekly topic that they like to share within the group and spark up some original conversations. All right, so on that note, I will stop sharing. I'll stop the announcements, and I will pass it off to my counterpart, Sarah Whitney, to lead us into our critical crossroads section and any other intro information that we need. Sarah, the floor is yours.
Thanks so much, Sean. Again, good morning, everyone. Thank you for joining us. I usually give a brief introduction of Healthier Black Elder Center, but Sean really did do a great introduction of our center for us this morning. So I will just reiterate that you can contact us if you have more questions about Healthier Black Elder Center. You can reach us on our website, www.ncuaar.org. And you can also call our office at 313-664-2616. For anyone that is not currently an HBEC member and would like to join, please call our office to complete a survey, and you will be added to our mailing list. Then you will receive our biannual newsletter that lists program events, recruiting studies, and additional health information. I'll go ahead and say the website and phone number one more time, and the website is www.m, as in Michael, aaar.org, and the phone number is 313-664-2616. Before beginning with our presentations, I just want to make a couple of quick housekeeping announcements. Today's webinar will be recorded and will be available to watch at a later time on our website. For those of you that are joining by computer, if you have a question for any of our speakers, you may submit your questions through the Zoom chat or through the Q&A box at the bottom of your screen at any time. And for those who are joining by telephone, you will not have similar capabilities while we're on the event live today, but if you do have any questions that don't get answered by the end of the program, you can call us at the HBEC office and leave a message with your question. One of our staff will follow up with you to provide an answer. So typically, we start our programs with a short presentation on a newer segment for the Lunch and Learn series called Critical Crossroads. And we have prepared a presentation on 3 voting rights petition drives that we should all be aware of as we're coming up on, important elections, and there are deadlines coming near this summer. But before diving into that, I would like to take a moment to acknowledge the tragic mass shootings that occurred this past weekend. I ask that you all please join me for a moment of silence for the lives that were lost and for their grieving families. Proceed with the prepared drive presentation. Currently, there are several petition drives related to voting that started in March 2022 and are racing toward summer deadlines to get their signatures currently. Today, I'm going to discuss 3 of them with you. It is really imperative that if you're presented with a petition that you read carefully and are really informed of all of the issues. So please do not sign any petitions or cast your vote until you have educated yourself. It's really important to understand the impact that these petitions can have if they're adopted on voting rights, processes, and access to ballots. So I'm going to go ahead and share a presentation. If you're on the phone, you will not be able to see it, but if you're on virtually, you can follow along with me. The first that I will discuss is the My Right to Vote petition. That petition is asking that we require 2 weekends of in-person absentee voting. It also requiring at least 1 drop-off box for absentee voting for every 15,000 registered voters. It would allow voters to receive absentee ballot applications without having to request them. It will require the postage of absentee ballots to be prepaid. It allows voters to verify their identity with photo ID or a signature. It will allow officials to prepare for counting absentee ballots within the 7-day period before Election Day. It would bar lawmakers from imposing an undue burden on the right to vote. It would ban laws that restrict contributions to fund elections, record voters, or discriminate against election challenges. It would prohibit requirements of voter ID for absentee voting or social security number to register to vote. And it would also require the legislature to fund elections. That is the MI, so my right to vote. Promote the vote is the second petition. I'll go over briefly. The language of this petition allows for 9 days of early voting, publicly subsidizes absentee ballots and tracking system for a ballot location. It allows voters to register for absentee ballots for all future elections. It also requires ballot drop boxes for 15,000 voters, every 15,000 voters in a municipality, and establishes that post-election audits can only be conducted by state and local officials. The last petition that I will discuss today is Secure My Vote. Again, the MI is for Michigan. This petition would require voter ID for in-person voting and absentee ballot application. It would also eliminate the affidavit exemption or the signature currently allowed for in-person voting without ID. This petition is asking that we require partial social security numbers for voter registration. It would require voters who don't present an ID in person to present it within 6 days after election for the vote to be counted. It would bar unsolicited absentee ballot applications, meaning that there would be no automatic mailings of absentee ballots. And it would ban outside funding for elections and restrict mail-in ballots. And lastly, would provide voters with hardships with free ID funded by a $3 million state fund. So again, it's very critical that you understand each different petition before you sign your signature. You may be asked, people are going around door to door and in public venues asking for signatures. On the surface, they may all seem very similar and the language makes them sound similar, but they are very, very different petitions. So it really is imperative that you understand and support and sign the petition that you really believe is going to reflect your beliefs and your beliefs about the right to vote. If you can't remember the language of each petition, just memorize the name of it, of the one or the ones that you support. And when asked to sign, make sure that you're signing the right one. If you want to learn more about each of these petitions that I've just discussed, you can visit the websites. They're listed here and I'll read them out loud. So that's My Right to Vote. So MIRIGHTTOVOTE.com. Also Promote the Vote 2022.com. Secure My Vote, that's SECUREMIVOTE.org. And if you'd like to track the progress of these petitions and any others that are floating around right now, you can visit bridgedetroit.com and search petition tracker. There you will find an article that's updated regularly discussing the progress of each of the petitions and their deadlines. And if you have any questions about anything that I've just shared, of course, you can call us at the Healthier Black Elder Center at 313-664-2616. Next, I will open the floor for researchers to recruit for their current studies. We have a few guests joining us today. Anna, we have two Annas. Anna Jolliffe, if I'm pronouncing that correctly, would you like to start us off?
Sure, thank you. So I'll read right from my script so I can keep it to a minute. My name is Anna Jolliffe, and I'm a research specialist at the University of Wisconsin-Madison in the lab of Dr. Nicole Werner. We received funding from the National Institutes of Health to develop a legal and financial education tool for caregivers of people living with Alzheimer's disease or related dementias. We're seeking participants for a research study that will involve completing an online survey. the goal of which is to understand the financial and legal planning needs for caregivers of people with dementia. You are eligible for this study if you are a family or a friend caregiver of a person with dementia. For example, maybe you are taking care of a spouse, a parent, or a friend with dementia. For taking the 15-minute survey, you will be compensated with a $20 Amazon gift card. If you would like to participate in the study or have questions about whether you qualify, please email me at ajolliffe@wisc.edu. I will also put my email address in the chat, and it's ajollif as in Frank, F as in Frank, at wisc.edu. Thank you.
Thank you, Anna. I'll invite Anna Luongo to present next, if you're still with us.
Yes, sorry about that.
No problem.
We had somebody come knock on my door. I had to speak with them for a minute. I'll just share my slide real quick and I'll walk through that. Okay, let me share my screen. Oh, can we not share?
You should be able to. Give me just a
Is it
second.
okay?
Okay, try it now.
Oh, now I can. Okay, cool. Okay, can you see my slide?
Yep.
Okay, awesome. So I'm Anna Luongo from the University of Michigan Fall Care Study. I'm a research assistant on the study, and our study focuses on the stress and well-being in the everyday lives of caregivers. So we're really focused on the daily experiences and the well-being of people who are living with and providing care for a family member or friend who has dementia. So there's a few different qualifications. If you want to take part in the study, you have to be Black or white, you have to be a Michigan resident, and you have to be someone who lives with and provides care for a family member or friend with a memory decline, or you have to be someone with a memory decline who is receiving care from a family member or friend. Participation involves a few different things. So the family member or friend who is providing care will complete a baseline survey. They will learn how to wear 2 heart monitors and complete surveys on a study cell phone. They will also wear those monitors and complete these surveys during 5 days of daily life. And the person living with dementia will complete a memory screener, and then they will wear a heart monitor, just 1 heart monitor, for 5 days. Participants are paid for taking part in our study, and we really do appreciate your dedication and time that you put into this. So we do compensate. And you can contact us at our phone line at 734-936-7489 if you are interested in learning more. We also have a study email. That is the swellcarestudy@umich.edu. So and then we also have the website as well, which is swellcare.isr.umich.edu. The HBC also has flyers of ours. So if you also want paper copies, you can get those as well. So thank you so much for your time and listening to my presentation. All right, I can stop sharing.
Thank you, Anna.
Yeah.
Next, I'll invite Dustin to speak.
Hi, hope everyone's doing well. I can also share my screen right now. Can everyone see that flyer?
Yes.
Okay, great. So I am a research assistant with the Families Coping Together with Alzheimer's Disease study. And it's actually a fairly similar study to the one Anna just presented. So if you are at least 55 years old and have memory loss, I know it says early stage dementia there, but we're including anyone that has any type of memory loss, and you have a child caregiver that is at least 18 years old, you and your child may be eligible to participate in our study. And the study seeks to understand your experience coping with dementia together. So participation involves 1 2-hour session, which is a survey, and 1 2-hour interactive Zoom session together with your parent. And you'll be completing tasks and answering discussions together while we record you. And these survey sessions can be completed over the phone. We can send you surveys through the mail, or we can send you links to the surveys online on the computer. And compensation can be up to $600 for the dyads for completing all sessions. And if you're interested, you can contact Kathleen Williams or myself. I'll put my phone number and email in the chat to make it easy to reach. So thank you.
Thank you, Dustin. Did I miss any of our researchers who have a study that they're recruiting for? Okay, well, thank you all again. To our audience, if you would like any of the materials that describe the studies or any more information about the studies, you can call us at the Healthier Black Elders Center office. Again, that number is 313-664-2616, and we can mail or email those to you. We will now go ahead and begin our main presentation. Our speaker today is Dr. Emilee Bohde. Dr. Bohde is lead physical therapist at the Recovery Project in Clinton Township. She's had a passion for neurological physical therapy since graduating from Oakland University in 2014. Her specializations include multiple sclerosis, oncology rehabilitation, and respiratory function. She's a guest lecturer at Oakland University in their physical therapy program, and she also serves as a member of the MS Society of Michigan Healthcare Provider Council and on the Oncology Rehabilitation Special Interest Group Committee. We want to extend a very warm welcome to Dr. Emilee Bohde.
Thank you so much, Sarah. We are so happy to be here with you all today, and thank you so much for the invitation. If you can just bear with me a quick second, I'm just going to share my screen so you can see the presentation. All right, hopefully everyone can see that all right. So today we will be discussing the road to cancer recovery, specifically facts about prehab and rehab for oncology patients. So thank you again for having us. We're so happy to be here today. So I just wanted to first go over a little bit about where I'm from. I work at the Recovery Project. We are a privately owned outpatient rehabilitation center founded in 2003. So we primarily treat neurological diagnoses. That's what we started as. So we started treating people with spinal cord injuries, traumatic brain injuries, and we've really expanded since that time in 2003. So we treat individuals with stroke, Parkinson's, multiple sclerosis. We have a oncology rehab program. We treat pelvic health as well as orthopedics. So we've really expanded since the beginning. We provide comprehensive and a multidisciplinary approach. So we at the Recovery Project have physical, occupational, and speech therapy. We also have medical massage, personal trainers, as well as a lot of group wellness classes. So our programs for the group wellness classes are both virtual as well as in person. So at the Recovery Project, we really are dedicated to utilizing the most evidence-based, cutting-edge treatments to assist our clients receive their highest quality of life possible. So what are the objectives for today? So today I'm going to define the term prehab. We're also going to describe why prehab is important following a cancer diagnosis and how it can positively benefit you while you're going through treatment as well as years after treatment. We're going to explain how the rehabilitation continuum is structured. And we're also going to talk about the oncology rehab services available to individuals individuals that are going through a cancer diagnosis. And then we will also define the process for establishing a prehab appointment and discuss what rehab may look like for you. Okay, so why did we want to start an oncology rehab program? So over the years, we've really learned that cancer survivors commonly experience a wide variety of deficits related to their cancer, as well as the treatment of their cancer. So treatment-related side effects can have a profound negative impact on function and quality of life for many years following treatment. So symptoms and side effects, they may actually develop during treatment, or they may not develop for weeks, months, or years after treatment has finished. So sometimes fatigue may not be more pronounced till a couple months after, or cognitive impairments may not develop, for months or years after as well. So we as physical therapists know, and we're skilled in treating different body systems, so such as the musculoskeletal system. So if someone comes to us for back pain, or if they've had a knee replacement, or for example, the cardiopulmonary system. So if someone comes to us after a heart attack and they're deconditioned and they have a hard time walking up the stairs. There's so many different body systems that physical therapists are trained to treat. So the same can be said for a cancer diagnosis. We know that cancer and its treatments affect multiple body systems, over time and during treatment. So we are skilled in treating those different side effects that affect the different body systems. So currently we know that there are between 16 and 18 million individuals in the US living with cancer. So despite that high occurrence, rehab is really largely underutilized because we know that only about 2 to 5% of cancer survivors are actually being referred to rehabilitation program. Hearing that, it is very discouraging and disappointing to hear. And really in the last 20 years, there's been a huge momentum about getting the word out about oncology rehab and prehab so that we can really improve individuals' quality of life. We know that upwards to 90% of people living with cancer can actually benefit from a specific oncology rehab program. That's why it's so important to get the word out. So you yourselves or someone you may know have had a hip or a knee replacement in the past. So with those diagnoses or with those surgeries, people are often referred to physical therapy prior to surgery in order to strengthen those muscles and to really improve their balance prior to undergoing the surgery, because we know that that will really optimize their outcomes following the surgery. So the same can be true for a cancer diagnosis as well. So what is prehab? We know that prehab is a comprehensive evaluation from a specialized oncology therapist. It may be a physical therapist, occupational therapist, or a speech therapist. It may be from all three disciplines as well, depending on what your limitations are. So ideally, people are referred to an oncology rehab program at the time of diagnosis. So if you've had physical therapy before, the first day is an evaluation. And that's where we perform different tests to assess functional status prior to any cancer treatments. So we want to get some baseline measures just to see where you are. This prehab is also done prior to any change in treatment. So we don't want you to be discouraged, especially with the numbers I talked about on the previous slide, because there really aren't too many people being referred to rehab for cancer. So don't be discouraged if you weren't referred to an oncology rehab program at the time of a cancer diagnosis. We are recommending that people do prehab prior to any change in treatment. So for example, if you're changing the type of chemotherapy that you're having, or if you are going to have another surgery, then we would recommend that you talk with your doctor, your oncologist, and get a prescription for an oncology rehab program. So prehab also involves different interventions designed to reduce cancer treatment complications and improve overall physical health. It's also a great time to discuss and go over patient education prior to treatment, because with such a huge life-altering diagnosis such as cancer, it's very overwhelming, and there's a lot that we can help with along the way just to ease fears and, discuss what potentially you may feel following the start of different cancer treatments or what to expect after surgery. So with Prehab, there is an extensive amount of education that goes into that as well. So why is Prehab important? So we know that Prehab allows the patient and the rehab team to establish baseline functional tolerance. So we want to assess how their endurance is, how their strength is, how their balance is prior to starting any of the treatments. So we also want to identify any risk factors that may impact success of treatment. We will provide individuals with education on how to best prepare for treatment, as well as teaching them safe activity levels during and after treatment. So for example, when can you start exercising following surgery? Or what exercises should you be doing after surgery? I'll go into that a little bit later. Prehab, also helps us to provide people with an understanding when it's appropriate to return to rehab. So maybe they've done prehab, they started their cancer treatment, and then they did a stint of rehabilitation. So now it's been a couple years since their cancer diagnosis. We would educate individuals on when it's safe and when they should really be getting a prescription to come back in for a tune-up, basically, and just a check-in and see, how you're doing a couple years or months after the onset of the cancer and the treatments. Prehab also allows us to develop a rapport and establish a relationship as another piece of the care team puzzle. So that's really important. We want to support you and be by your side. And if there's any questions or fears or anything like that, we're here to support you on your journey. So Prehab provides newly diagnosed cancer patients with a full picture of what to expect during all phases of their journey. As I talked about, it is a very daunting and overwhelming process. So we're there with you every step of the way. So from the time of diagnosis through treatment, as well as during cancer rehab therapy. It also helps to decrease the unknowns, which leads to less anxiety during treatment itself. And it makes people more aware of potential complications, which leads to quicker intervention if needed. So for example, sometimes every new pain or sensation can put people on high alert and make them worry or fear that their cancer has recurred or spread. So oncology, rehab, and prehab can help ease those fears because it empowers you with the education to really know how your body will respond during treatment and what you can expect as well. So how exactly is prehab structured? So like I said before, we really want patients to be referred to an oncology rehab program at the time of diagnosis, not down the road like months or years after symptoms start to develop. So for example, there are some chemotherapies that have a higher prevalence of peripheral neuropathy. So that may be numbness or tingling in the hands and the feet. And then that can affect someone's balance or walking. So we don't want people to come in, just when they start experiencing those symptoms. We want people to be come in for therapy prior to that, so we can really focus on strengthening those muscles to help with balance, and work on different sensation techniques as well to help eliminate and decrease any symptoms of peripheral neuropathy before it even develops. So with prehab, it's typically 1 to 2 visits prior to start of any treatment or surgery. So the first day is the initial evaluation. As I said, if you've had therapy, you are very familiar with that. First day is a lot of talking, a lot of testing. That's when we get our baseline comprehensive assessment just to see where you are on the first day. That day, we're also providing education, talking to you, and hearing what type of treatments you'll be undergoing, eliminating any fears if we can. And then after that, you will have 1 to 2 additional visits of prehab. This is when we will provide you with a home exercise program. And we can address any pre-existing deficits. So maybe 10 years earlier, you fell and you hurt your shoulder and you ended up having a shoulder replacement. So you may still have issues lifting your arms overhead to blow dry your hair or to reach for that glass on the top shelf. So we would address that at the time of those visits and give you exercises to help with the strength and the range of motion. Maybe you've had issues in the past where you had poor balance, maybe just for some weakness, or if you have hip arthritis. So we would give you exercises to specifically strengthen those muscles, balance exercises to address those impairments. So that way you're fully prepared and ready going into cancer treatment as well. Again, I know I keep saying this, but education really is a huge part of prehab, as well as throughout rehab as well. So it allows us to help you best prepare for treatment. It allows us to talk with you guys about what is safe and appropriate levels of activity following treatment. Like, when can you start lifting your arm or lifting a gallon of milk out of the fridge? And then, as I said before, it allows us to let you know when to return to rehab to address any ongoing issues following treatment as well. So as I mentioned, the first visit will be used to establish your baseline. So like I said, we do a lot of talking. We want to know your past medical history that will affect cancer treatment. So do you have any history of diabetes or hypertension or cardiac problems in the past that may limit your progress after starting cancer treatment? We'll also do joint range of motion and posture. Do you have a hard time lifting your arms up to wash your hair? Because this may be due to a prior shoulder injury. We want to check your strength, and we may do that by doing a sit to stand test. See how many times you can get out of a chair, or time you standing up and sitting down 5 times. And then we would take those measures, and once you return to rehab, recheck you again and see if there has been any changes. Maybe it takes you a little bit longer to stand up from a chair than it did in the past. That would tell us that the leg strength has decreased a little bit. We also want to check your endurance. So we do a 6-minute walk test in our clinic, and that's basically having you walk for 6 minutes straight and see how far you can go during that time. And that, is really based on research and can give us a good idea where your current cardio endurance is, and then compare you once you return for rehab as well. We do a lot of balance testing, sensation testing as well. We may also want to do specific arm or leg volume measurements. So measure the girth of the arms or the legs. We are finding that more chemotherapies cause swelling, and that's not to be confused with lymphedema. So we just want to assess to see if there's any swelling in the limbs prior to starting treatment. And then we can really track carefully if any swelling, fluctuations, or changes increase as treatment goes on. We also want to know what your current level of function is. Do you get up every morning and go to the gym, or do you go swimming at the local pool and do a ton of laps in the morning? So what is your current lifestyle? What are your hobbies? Do you watch your grandkids? Do you enjoy working in the garden? We want to know what your current and overall quality of life is. We also want to see and screen you for any swallowing or speech problems as well, especially if you have a head and neck cancer. That is something that we can help you in rehab to make it easier to swallow and communicate with others. So knowing these baseline values will allow your team to recognize any physical decline or problems resulting from cancer and its treatment. So identifying risk factors is also really important on that first initial evaluation and at baseline. So we like to screen and see if individuals have a history of diabetes, either type 1 or type 2 diabetes. Do you currently smoke? How is your diet? Are you currently getting enough physical activity? Are you overweight? So all of these risk factors may slow down the healing process and may further tax your cardiovascular system. So we want to address these risk factors and help you manage those as you're going into starting cancer treatment. So for example, we know that diabetes causes damage to arteries and capillaries. And we also know that lymphedema is the result of damage to the lymphatic system. So together, these two diseases can lead to damage to the connective tissue and the skin, thereby increasing swelling and increasing risk of infection. So it just kind of complicates some of the side effects that we're already seeing with the cancer diagnosis if you have pre-existing risk factors. So again, identifying these risk factors will help us best prepare you for treatment, as well as possible outcomes, what to expect, and how we can help you the best we can. So learning how to prepare for treatment, as you all know, there are many side effects of cancer and its treatments. So we can help you be best prepared for that. So prior to starting any cancer treatment, if you're doing chemotherapy, surgery, radiation, maybe you're doing all three of those, there are specific things to look for with each one. And then there's also some overlapping symptoms between the three of those as well. So prior to starting chemotherapy, we want to discuss options for fatigue management strategies. So we know that specifically with chemotherapy, fatigue often gets worse first, and then it may start to get a little bit better before you have your next round of chemotherapy. So again, fatigue usually gets worse a few days after chemo, then may get a little bit better. And then fatigue with radiation typically gets worse a few weeks after radiation. So there's a little bit difference between those two. And I understand there's so many different types of chemotherapies, you know, and when you take them as well. So it's a little bit different too. But that's why it's important to discuss with an oncology rehab provider so we know exactly what type of chemotherapy or immunotherapies that you're undergoing. So that way we know how to best educate you and help you as well. But the good news is we know through extensive research that exercise can really decrease cancer-related fatigue and improve your overall energy levels and just get you feeling better as well. With chemotherapy too, as well as other cancer treatments, we do want to discuss energy conservation education as well. So maybe you want to sit down as you're getting ready in the morning, doing your hair, doing your makeup, putting your shirt on, your shoes and socks. That will help conserve energy for later in the day. We also recommend specific activity and exercise levels to prevent physical deconditioning during treatment. So when is it safe to exercise again, and what specific exercises you should be doing during chemotherapy. And you may benefit from therapy first if you're already deconditioned. So that's why it's really important to get that screen with Prehab. So that way we know what your baseline measures are and how we can best support you. You know, prior to surgery, we would provide you with education regarding your specific surgery, what to expect. And as well as education regarding surgical complications, you should report to your oncologist or surgeon. For example, wherever the surgery site may be, if you notice redness, heat, so like increased warmth or swelling, it may be a sign of infection, and that would be something that you would want to alert your surgeon about. We would also give you and go through pre-surgical exercises to help address any pre-existing impairments or improve your overall physical condition and endurance leading into surgery. So giving you posture and range of motion exercises will help with outcomes following a mastectomy. Recommending exercises after certain surgeries and when those should be initiated. So for example, stretches are very essential after surgery, but when is it safe to start doing those stretches? We want to begin exercises slowly after surgery, because we know that overdoing any exercising or stretching can increase pain, swelling, slow the healing process, and may trigger lymphedema. And then for radiation, range of motion is key with radiation. So we want to give you exercises to ensure appropriate positioning for treatment is attainable. So we know that radiation-induced fibrosis, which is skin thickening, muscle shortening, and it decreases joint mobility. So just overall tightness can occur following radiation. That's pretty common in head and neck cancers, as well as breast, lung, and abdominal and pelvic cancers as well. So being aware of that and continuing with your stretches will help with access to the radiation, as well as movements with your everyday life as well. Just like surgery, we want to give you education regarding potential complications that may arise in order for you to know what they are, so that you can report it back to your radiation oncologist as well as exercises to improve optimal function and prevent loss of range of motion once you have started radiation. And then giving you a recommended timeline for when to start exercising and stretching, and how to do that in a safe manner as well. So what exactly are safe activity levels? So research tells us that it is safe to exercise at all points of the cancer trajectory. So that's at time of cancer diagnosis, throughout active cancer treatment, as well as years post treatment may have finished. So what we would do during prehab, we're discussing with you what your most recent blood values are. So safe activity levels are really dependent on a variety of factors. So we know specifically with chemotherapy, we are checking in with you guys regularly on what your most recent blood work lab values are. So for example, in regards to physical activity and exercise, we are really taking a look at your platelet levels as well as your hemoglobin. So we know that if your platelet levels are below 60,000, we don't recommend any resistance exercises. If your platelet levels are below 20,000, that's when we typically focus on active range of motion. Maybe light, gentle walking is okay. So we kind of really ease back on the intensity of the workout. And if your platelets are below 5,000, that's when we wouldn't recommend any activity, and maybe taking a day or two off from oncology rehab during, or any exercise if your platelets are that low, because it's just too dangerous to do any form of physical activity with your platelet levels being so low. And then for hemoglobin, we don't ever want your levels below 8. That's when we would not exercise, and you would be seeing your doctor for further recommendations. Also, safe activity levels are really dependent on cancer-related fatigue. As I mentioned before, we know exercise can decrease cancer-related fatigue. The specific guidelines of exercise and physical activity to help with fatigue associated with cancer is 30 minutes of moderate intensity aerobic exercise 3 times a week, and then 30 minutes of resistance training 2 times a week. That has, that's what research tells us will really improve overall fatigue levels and improve endurance. And then also during chemotherapy, are you in active treatment? Are you completed? Are you still undergoing the treatment as well? So we know it is safe to exercise and attend therapy the same day as chemotherapy, but it's recommended to wait at least 2 hours after chemo or radiation to come in for therapy. And you know, that's when we would check in with you guys, and we would possibly modify what we do that day, depending on what your energy levels are, depending on how you feel immediately after the chemo or the radiation as well. With surgery, we check in to see what specific surgery was completed. We want to know that because that will guide us with our plan of care with you. We also want to know if the surgeon has given you any specific restrictions. So for example, do you have any lifting restrictions where you can't lift greater than 5 pounds? If that's the case, you can't lift a full gallon of milk out of the fridge because that's typically about 8 pounds. You may also, some of the restrictions may also be avoiding any repetitive movements as well. So we would help, outline that for you so that you are adhering to those restrictions and ensuring that you are safe. Also, phases of tissue healing is also really important because that will tell us when it is safe to start exercising and stretching. And I'll go over that in just a second, as well as if you've had any lymph nodes removed, because that affects outcomes as well. So we would go over education on recommendations if you are traveling by airplane or traveling long distances, for example, or, simply if you're out in the yard doing yard work, being mindful of mosquito bites or different things like that. So lots of education to help you and empower you with that. And then lastly, radiation. Are there any specific restrictions from your radiation oncologist? So we would help you understand those guidelines. And, radiation can affect blood counts as well. So monitoring blood work values. And again, if you're in active treatment or if you finished radiation as well. So we need to know safe heart rate ranges in which to exercise. Typically resting heart rate is more, if it's more than 100 or less than 50, that's a red flag for us. So we use that to guide our treatment as well. So the ideal continuum of care kind of looks like this. So typically at the time of cancer diagnosis, people are being referred to an oncology rehab program for prehab. So you guys know what that is now, typically 1 to 3 visits. And then you would continue with the start of treatment if it's surgery, chemo, radiation, or a combination of those. And then 3 weeks after the start of treatment, that's when you would typically begin an oncology rehab program and survivorship and joining support groups and being a part of wonderful organizations. So we know with prehab as well, which I haven't mentioned just yet, that prehab reduces hospital length of stay and decreases ER return visits. And it also reduces post-treatment symptom impact. So there are a huge number of benefits for prehab and rehab, as we know. So the 3-week rule, this is a rule of thumb for us oncology rehab therapists. It is typically safe to resume therapy 3 weeks after surgery or after the start of any treatment, as this is when the body is really starting to heal. So there's 3 different phases of normal wound healing or the healing process, and they do kind of overlap, each 3. So the first one is the inflammatory phase. This would be, for example, right after having surgery. The inflammatory phase lasts about 4 to 6 days. Typically during this period, you notice a lot of swelling, redness, pain, and inflammation. This is when the healing process is triggered in the body. And the immune system is heightened and it works to prevent bacteria from forming. So there's a lot of rest during this period, allow the body to heal and do its work. The next phase is the proliferation phase. That lasts another 4 to 24 days. So again, you can see some overlap between the inflammatory and the proliferation phase. This is when new tissues start to fill the wound or the incision, and cells called fibroblasts lay collagen down to help strengthen that new tissue. And then the final phase is the remodeling phase, and that lasts another 21 days to 2 years. So that length of time depends on the patient. Do they have a history of diabetes, which may slow down healing times, and wound-related factors as well. This is when the wound is really strengthened and scar tissue forms. So typically, seeing this diagram and knowing the phases of wound healing, you can see that typically we use this as a guideline. So 3 weeks or 21 days after start of treatment or surgery, that's when it's typically safe to start a oncology rehabilitation program. So now we'll talk a little bit about rehab and what to expect with that. So as I mentioned, rehabilitation is recommended 3 weeks following the start of chemo or radiation or after surgery. So you've had your prehab visit, you have your baseline measures. Now after starting treatments, you come in 3 weeks later and you're returning for a follow-up assessment. So we want to see how you're doing compared to that first day before you started any treatments. This is when we start focusing on areas that your treatment is affecting. If you've noticed more fatigue, noticed your balance is more impaired, weakness in your legs or your arms, we'll start really focusing and designing a plan that's specific for you. Rehab will also help to prevent any secondary complications as well. Throughout the rehab process, just as you learned with prehab, we are continuing to provide extensive education on how to best navigate treatment and its related side effects so that you're best prepared for any outcomes, and as well as providing treatment for issues that may continue to affect you beyond treatment. So for example, if you're noticing that you are becoming more forgetful, or if you have some cognitive impairments, we may refer you to one of our speech therapists, and they would really help you with different strategies to help optimize the brain and your cognition, just to help with those side effects. So we know there are a lot of benefits from specific exercise training and physical activity to the cancer survivor. So we know that with regular exercise during and after treatments, you notice specific improvements in building muscle mass and strength, overall power. You should feel, for example, it's easier to climb a flight of stairs, or stand up from a chair, or get out of bed. It also improves overall physical function and physical activity levels. Maybe you notice that you're having an easier time catching up with your grandkids, or playing with them in the yard. There should be improvements with range of motion. Overall immune system function has improved with exercise as well. Research also tells us that people who regularly participate in an oncology rehab program or regular exercise or physical activity, they actually have higher completion rates for chemotherapy. And it also helps with overall body image and self-esteem and mood as well, because you're increasing those happy hormones as you exercise. So you just oftentimes feel a little bit better about yourselves as well. We know that regular exercise as well can reduce the number of symptoms and side effects that you may experience, or they may reduce, maybe the symptoms and side effects aren't as strong or as noticeable as they may be without exercise. We also know that regular exercise reduces duration of hospital stays, as well as the severity of the side effects. Again, it reduces psychological and emotional stress, as well as depression and anxiety as well. So lots of benefits with regular physical activity. Okay, so what exactly are safe exercise guidelines? So first and foremost, it's really important before starting any exercise program that individuals should be medically cleared by their physician, their oncologist, or their surgeon. Throughout the process, they should really be abiding by lifting restrictions at all times, and if there's any other restrictions given to them by their oncologist or their surgeon. So adhering to those will just optimize outcomes in the long run. So another thing that we're always telling our patients as well, it's not the number of exercises you do, it's doing the right exercises. So seeing a therapist will help you know what areas may be weak on you, so that we can really focus on that and improve, the deficit. So posture impairments, range of motion impairments, or if you have problems with balance or walking, we will target the specific muscles to help those areas, and you will notice a difference. We also know that good form is the key to success, not repetitions. I have some patients that they just want to get these done as fast as possible. They're like, well, I did 50 of them, but you did them too fast and the form wasn't looking good. I would rather have you do 20 to 30 of them with really good form, focusing on the specific muscles as well. So form is key. We also know that exercises should be modified to fit any situation. So we can give you strategies and specific, maybe simple stretches that you can do throughout your workday, just to keep you moving. For example, if you're going out of town on vacation, or if you're staying at a hotel, we can see clients over the computer, over their phone for telehealth. That may help with compliance to exercises and motivation levels as well. So just know that we can modify really any situation to best fit your needs and help with motivation. One thing I also wanted to touch on too, a lot of people don't like to exercise, and just hearing about exercise can be very daunting, or having to go to the gym. So just know that we like to encourage physical activity. So the American College of Sports Medicine gives specific physical activity guidelines, which we encourage our clients to do. So we really want to encourage clients to aim for about 150 to 300 minutes of moderate intensity exercise or physical activity each week. So it doesn't necessarily mean you have to go to the gym and do the different weight machines and the treadmill. Physical activity can be any form of activity that increases your heart rate above that resting level. So again, maybe it's out in the garden and pulling weeds and digging in the dirt. That can get your heart rate up. Or going for a walk with a friend, talking with them, that will get your heart rate up. Playing with grandkids, dancing in the kitchen while you're cooking. There's so many different things that you can do to help put towards those 150 and 300 minutes of moderate intense activity each week. We also recommend that muscle strengthening two or more days a week should be done to help optimize your function and decrease any side effects as well. So when should people return to therapy, or when should they even participate in an oncology rehab program? So like I said, 90% of individuals undergoing cancer, and it's with a cancer diagnosis and undergoing treatment, would benefit from some sort of therapy. So you may notice that you have a new pain or discomfort. Maybe you have tightness, pain, or difficulty with normal activities or hobbies. So that would be a good time to get back on schedule and be evaluated by an oncology rehab therapist as well. Maybe you have noticed a specific heaviness or achiness in your arm or your leg after lymph node removal. Or if you have pain or discomfort with swallowing, maybe it's just difficult to swallow water. These are different warnings that should encourage you to go see a therapist. So they may do specific manual therapy like stretching or massage, anything to help relax those muscles, help with range of motion as well. So you also may notice impaired range of motion. Maybe you have a lot of tightness after radiation, and now it's hard to reach for the glass, like I already mentioned before, or putting on your shirt, or reaching into your back pocket. So difficulty with daily tasks or hobbies, if it's just a little bit harder and you're not getting as much enjoyment as you did before because it's a little bit more difficult, that is a good cue for you to get back on schedule as well. Chemo or cancer-related fatigue affects 70 to 100% of survivors. So this may be a weakness or a fatigue that is disproportionate to activity. So no matter how many naps you take throughout the day or how much rest you're getting, your fatigue is just so significant. It's hard to get up and move and to do anything at all. So once it starts interfering with your daily life, you know, that's again a cue to get moving and increase your physical activity levels. And sometimes that can only be helped with motivation from a therapist or a family member as well. Neuropathy and impaired balance is also pretty common as well. So I kind of touched on this a little bit earlier, but that would be a numbness or tingling, maybe sensation changes that you're noticing. Do you have difficulty walking? Are you tripping over things? Are you having falls? We know that chemo-induced peripheral neuropathy, you know, with specific types of chemotherapies, that typically develops about 68% of the time within the first 30 days of chemo treatment. So that's why it's really important to start a rehab program as fast as possible, just to help alleviate any symptoms and side effects related to the chemo-induced peripheral neuropathy. So some things we do for that to help with balance. We like to use vibration in our sessions. Sometimes we have people stand over vibration plates and do squats or balance or strengthening exercises on that. We also have different therapies and modalities such as infrared light. Sometimes people think of it like a laser treatment. That's basically a deep heat treatment. We use that infrared light sometimes on the bottom of the feet or around the feet if people have neuropathy, and people feel like that actually helps their symptoms and gets them to feel better, maybe move their toes a little bit better. We also want to do higher level balance activities in a safe setting. So maybe taking you outside and do different walking and balance exercises over the grass, because that's an uneven surface. And doing it with us, knowing that you're safe because we're guarding you closely. So really challenging you and taking you out of your comfort zone in a safe setting. You may also return to therapy if you've noticed any cardiac implications such as shortness of breath or decreased endurance, which we've talked about. With our oncology rehab program, we really closely monitor vitals. So getting vitals at the start of the session, throughout our exercises, and then again at the end, so we can see how your cardiovascular system and how your body is really responding to the exercises we're doing with you. And then we also do cardio training as well. So maybe doing treadmill training or using the bikes with you, monitoring you closely to make sure that you're okay. As I mentioned before too, cognitive changes are pretty prevalent with cancer treatment. So you may notice you have difficulty with word finding or difficulty focusing on a task. Recalling or remembering. So at that point, we may refer you to one of our occupational therapists or a speech therapist for specific cognitive training. If you're on physical therapy, we may work on dual or triple tasking. So for example, while you're walking around the gym or walking on the treadmill, we're asking you to say different states that start with the letter M, and maybe also curling and arm weight at the same time. So doing multiple things at once to really challenge the brain and challenge your cognitive function. And then lastly, psychosocial changes. We know that there is depression associated with cancer treatment. 1 in 4 cancer survivors, so 25%, are formally diagnosed with clinical depression. So have you noticed, has your quality of life been affected by cancer treatment? So, you know, being referred maybe to a psychologist or referred to an oncology rehab program for exercise, we know that regular exercise can help with clinical depression and help your symptoms and your overall well-being and quality of life as well. So our oncology rehab treatment approach, just a little bit about what that looks like. I kind of already talked about it, but when you're looking for an oncology rehab program, we know that there's physical therapy clinics on every corner. So, you want to make sure that they treat individuals living with cancer and ask them if they specifically have an oncology rehab program. So at the Recovery Project, we have physical, occupational, and speech therapists and trainers that have advanced education to serve cancer survivors. So providing one-on-one care for a full hour. That way we can really address any questions or concerns that you have, provide you with any education, and go through exercises and maybe do a hands-on approach as well. So there's a lot of different treatments, and this is just an overview, because when you come in for prehab or rehab, that's when we see what problems you're having and design a program that is specific to your needs. But just an overview. Exercise is at the forefront. We use different exercise interventions to improve your strength, your balance, and your walking. We provide manual therapy or hands-on skills for range of motion, to decrease pain, to manage any swelling or edema. So we can do massage, range of motion, stretching. We provide cognitive interventions to minimize the effects of chemo fog. So that would be, again, like I mentioned, referred to an OT or a speech therapist, or doing interventions in physical therapy, or all three, just to really address your specific impairments. We do a lot of fall prevention as well. If someone does have a fall, how can you safely get up from the floor? So do caregiver education with that as well, train you for that. And then also doing specific strength and balance exercises to help prevent those falls. That's most importantly. If individuals have problems swallowing, we do offer vital stimulation, which is basically electrical stimulation that we put on the muscles of the throat. That would have to be cleared by your oncologist before we would recommend that treatment. And that gets those muscles of the throat, the swallowing muscles, to contract. And they work on swallowing different types of foods and consistencies, as well as doing specific strengthening exercises of those muscles. And I've heard from my patients that they've noticed an improvement in their swallowing within the first 1 to 2 sessions, that it's easier to swallowing after doing the vital stimulation as well. We provide specific treatments and education strategies to address if you have any urinary incontinence, or pelvic floor issues, if you have pelvic pain as well. We have some awesome therapists that are specifically trained to treat those issues. We provide strategies to decrease cancer-related fatigue, conserve energy, and really optimize your cardio function and endurance. We provide significant education to family and care partners and caregivers, as well as specific coping strategies to help you with, and maybe connect you with other individuals going through similar things, or recommend a specific support group to help you. So here is our goal for an improved model of care. So as you can see, surgery, chemotherapy, radiation therapy, immunotherapies, these are treatments that are commonly used in any cancer diagnosis. So we know that oncology rehab is the missing piece of the puzzle. So along with these treatments of surgery, chemo, radiation, rehab is necessary to really optimize outcomes and improve your overall quality of life. We also know that the American Cancer Society now identifies rehab as crucial, if not mandatory, a mandatory component of cancer care as well. So you are having these different treatments. So we want to provide you with different strategies and exercises and just additional support to improve your overall quality of life. Just knowing that you don't have to live with these side effects and these symptoms, and that there is help specifically out there for you as well. So basically the next step, if you're interested in participating in a prehab or rehab program, you would talk with your oncologist or one of your physicians about getting a script. And then you would locate an oncology rehab program and really start on your road to recovery. So lastly, our goal is to help every cancer survivor return to their highest level of function and greatest quality of life, both during treatment and for many years to come. All right, so I will open it up to any questions.
All right, Emily, here's one question. I saw that there is 60-minute sessions that the patients work with. How much homework do you send with them? What are they supposed to do in the off time between appointments?
That's a great question. So typically, I know we have restrictions with insurance. Sometimes when we've given these talks, just so you guys know, insurance does cover oncology rehab. But that being said, the insurance may only allow us to see you 1 to 2 times a week, maybe 3 times a week for an hour each time. So we know that's not enough time. So typically after your first initial baseline visit, we would provide you with specific exercise handouts or specific TheraBands and different recommendations to help you improve your recovery at home. So, you know, just a general guideline, I typically recommend doing strengthening every other day, stretching every day, balance exercises every day, and the therapist would specifically outline that for you, what to perform so that you're meeting those guidelines of at least 150 minutes of physical activity a week. So your therapy can count towards those 150 minutes, but then we will give you supplemental resources and different handouts to help reach that next level.
All right, very good. Thank you.
Mm-hmm.
Let's see, I am not seeing really any other questions coming up in the Q&A. Sarah, did you have any questions that you may have received during the presentation?
It may have been addressed already, but if you could reiterate, how might you come in contact with a practitioner for rehab or prehab? Do you have to be referred? Are doctors offering that up? Do you have to ask about it?
Yeah, that's a great question. So I always recommend that you guys are your best advocates. Your family members are also there to support you as well. So, you know, starting that conversation with your oncologist, maybe if they haven't directly told you about oncology rehab or referred you, you should bring it up to them. And I know so many different oncology offices, they have a lot of nurses that work there that can provide recommendations as well, or the American Cancer Society website too. So I would start there talking with the oncologist and their nurses, and if they have any social workers that work there too, and they can specifically direct you to an oncology rehab program. And if you find a physical therapy clinic that you like, just be sure to ask that they have therapists specifically trained with extensive education on cancer and treatments as well. Hopefully that answered your question.
Thank you so much.
Yeah.
Are there any other questions from the audience? Again, you can put them in the chat box or in the Q&A box at the bottom of your screen. You've done such an
No,
excellent
Sarah, I'm not
job.
seeing anything else come up.
Yeah, I'm not either. You've done a really excellent job, Dr. Bohde, of, really covering the breadth of what we need to know about prehab and rehab for oncology. So thank you so much for being here.
Thank you so much, Sarah and Sean. It was a pleasure, and we really appreciate the invitation. So thank you again.
Absolutely. Well, again, thank you. Thank you to Dr. Bohde. Thank you to our researchers for coming to our event this morning. And thank you to all of you, our audience members, for joining us today. Again, today's presentation has been recorded and it will be uploaded to our website where you can access this and other past Lunch and Learn videos. And if there's anyone that's not yet a member of the Healthier Black Elders Center program and would like to join, we can sign you up over the telephone. You can give us a call at 313-664-2616. And when you become an HBEC member, you will receive our biannual newsletter, learn about research studies like the ones that you heard about today, and future programs like this one. So we hope to see you all next month at our Lunch and Learn, which will be a presentation from Meg Watt of the Alzheimer's Association on healthy habits for a healthy brain. And that will be on Wednesday, June 15th at 11 a.m. using the same Zoom information, whether it's the link or the phone number that you used today. We hope you'll join us then. Take care, everyone. Stay safe and have a great afternoon.
Thank you so much.